Again is making changes to COVID shot recommendations. An update on the agency's website now includes specific instructions for parents of healthy kids. As you can see, joining us right now is Dr. Todd Ellerin, Chief of Infectious Diseases at Southern Health. It's always great to see you, Dr.
Good to see you, Eddie.
So the CDC used to recommend an annual COVID for everyone 6 months and older. And then earlier this week, federal health officials announced that they would no longer recommend the shot for healthy kids. So what is and why is the change now? What's this latest change?
Right, so the latest change is that we just heard that they weren't going to recommend it. Now the CDC basically said they're going to use shared decision making. So they're basically saying that you want to sit down, parents and the kids can sit down with their providers and decide risks, benefits, alternatives, what do you think? And obviously that's better, there's choice, right? That's the good news. The bad news is shared decision making is really tough for pediatricians.
Right.
And because everyone's so busy, so it's hard to do that. So it's going to be challenging logistically, but at least it's on the table and hopefully insurers will be covering, right?
Which is a major part of the equation. Vaccination rates for children are typically low, right?
They have been low.
They have been low. So in fact, take a look at the numbers. Nationally, this past year, only 13% got the shot, which means a significantly larger portion did not. Here in Massachusetts, the rate doubled, but only to 26.1%, which is almost 75% did not. So do you know what you're going to tell, you're a doctor, what are you going to tell these patients now?
Right, Massachusetts is often a leader with vaccination, but like you said, the reality is Americans have issues with the COVID booster. Irrespective of what the FDA is saying, the CDC is saying, 13% of children got boosted last year. And when you look at the highest risk group, those kids under 5% of kids got the booster. So the question is, what's the issue here? And I think what the FDA recently said in the New England Journal of Medicine, the sounding board, is that we really need to study this in the healthy kids and the healthy young adults as well, to say 5 years out, do we still need an annual booster? I think there's equipoise here, and that's a fancy word, but what that means we're not sure. We know it's safe, but we know the risk to healthy people is low. So let's study it and see what the reality is.
Also this week, federal health officials announced that they would no longer recommend the COVID shot for pregnant women. And what's the latest? Do we have any new information on that tonight?
This is even more confusing.
Okay.
Because the CDC has removed from their graphic that looks at risk conditions. With pregnancy, it used to be we recommend it for pregnant women, right? They were a high risk group. But they've recently put it in what we call a gray box, which means they're currently not making a recommendation. They're not recommending it. They're not saying it's contraindicated. On other parts of the CDC website, they're still recommending. They are going to be meeting, their advisory committee is going to be meeting in the end of June, and I'm really waiting to see what happens here. I'm hoping, at the very least, that it's shared decision making. Why? Because pregnancy, you have those babies that when they're under 6 months, they can't get the vaccine, which means the only way they can get immunity is through the mom getting vaccinated and having those antibodies cross through the placenta to the fetus.
Yeah, it's almost amazing. Here we are, what, 5 years later? We still have absolute answers on most of these categories.
If your head is spinning over this, mine is, so you're not alone.
All right, Dr. T, thank you, Maria.